And speaking of Team USA, it's time for the SMX medical update. We bring Dr. Joe McGinley from the McGinley Clinic here. I cannot believe Team USA has been able to absorb 2 injuries to the 3 riders, or actually 3, because Aaron Plessinger is still ailing a bit, even though he's still on the team. But let's first get to last week's news. So Chance HYMAS out. He thought he could manage this knee without an ACL. He couldn't. What do you think changed maybe with his, I should be okay, and then it turned out he can't go?
Yeah, so for a team of 3 riders, man, they're keeping us busy on the conversations here. It's great we have a team together. Can't wait to watch them out and riding. But yeah, Chance HYMAS, that's unfortunate. Great kid, wonderful opportunity to race, and had this injury that he pushed through all summer with the torn ACL, then got aggravated at the beginning of SMX. He did his best to try to get out there. He gave up the last 2 rounds and decided not to race the last 2 rounds of SMX, which in and of itself, that's a big sacrifice with all the money on the line. And he was focused on getting ready for Motocross of Nations. Unfortunately, he posted a video online of him getting that knee drained. And, I saw that, and they took a lot of blood out of that knee. So when I saw that, it was a little bit concerning. When you see blood in the knee, that usually means there's at least some microfracture and you're getting bleeding into the knee. And then when you take that blood out of there, that can create some pressure on those bones that are injured or contused or microfractured, and then that pain can be problematic. But he's trying to get through it. Yeah, unfortunate news that he wasn't able to race and had to pull out.
Yeah, so Dr. Joe, I have a question for you. I was in a similar situation in 2011, and our broadcast team member, James Stewart, actually landed on me at Houston 2011, tore my ACL, had a bunch of meniscus damage. But I continued to race with it simply because I needed to. And we went to Daytona. I was having a lot of pain in it, and the decision was made to drain it in a similar way to Chance HYMAS. We were all hoping that this would make it better. I would see some improvement pain management wise, and it was so much worse. I remember Daytona was one of the most painful days of the entire experience on the back end of having that drain. And I was caught off guard. I had no idea that would go that way. So in that, if you're the doctor managing this injury, is that something you would maybe recommend doing or not doing? Because I remember in my personal experience at the time, it was a no-brainer. Hey, you have a lot of swelling. Let's remove that. You're going to get some pain relief out of it. And it went completely the opposite direction for me.
Yeah, that's frustrating, right? When you get a procedure, you think it's going to work and you get the opposite effect. From my side of things, I'd need to see the imaging to see exactly what was going on in there. That would make all the difference in the world. So intuitively, if you injure the knee and you get swelling, that swelling creates a lot of pressure on the joint, makes the joint difficult to move. So, the correct thing typically is to get the fluid off. Now, if you take that fluid off and there's blood in there, that usually means it's a little bit worse than you were expecting. And sometimes that fluid can act like a separator or spacer in there and sort of alleviating the pressure on those injured areas. So in your situation, it may have been a little bit worse than anticipated. When they took the fluid off, those bones that were injured or irritated were now contacting each other, and then that was causing increased pain because they were already irritated. You relieve that cushioning from the fluid, and that made that situation worse. That's hard to say. If you have the imaging, that's a little bit easier to make that call. But yeah, intuitively, if there's swelling, you get the fluid off, you think it's going to be better unless there's something else going on.
Now we'll move to Aaron Plessinger, who hurt his shoulder at the first SMX round and definitely caused a drop-off in his results. But he was much better now in Las Vegas. I asked him about the shoulder injury. Kind of didn't break the collarbone, but hurt both ends of it where it attaches to the sternum and then to the shoulder. So just talk about what he could be dealing with there.
Yeah, great news is, he's still riding. He's still out there racing. Great weekend of racing this past weekend. So he's progressing in the right direction. He's doing all the right things. Seeing Dr. G getting all the anti-inflammatory work done to help with that area. So with the clavicle, most times we're talking about breaks, so fractures of the clavicle. That's one of the most common injuries we see in motocross. But you can have dislocations as well. So at the AC joint, if you have an injury, sometimes those bones can separate. That can be a little bit more problematic. There are ligaments on both sides of the clavicle. So the clavicle is your collarbone, and there's ligaments closer to your chest, and then there's ligaments that hold it along the outside of the shoulder. So if you strain those ligaments, it creates some motion that can occur on that bone. So if you can imagine you're riding, that's a big stabilizing structure of your shoulder, and now that bone's moving a little bit relative to the joint. That could cause quite a bit of pain, discomfort, and irritation. But the good news is those ligaments are still intact. So structurally, everything's sound. It's just a little bit loose. So the procedures and things he's getting done, that's the correct way to go. He's improving, so I don't expect him to miss the race. I think he's going to be out there strong in riding. He's not going to let us know. I'm sure we'll be bugging him a little bit for sure. But he's a tough guy. He's going to be out there riding and representing the USA exceptionally well.
Yeah, all Team USA fans that saw Plessinger running well in that final moto in Las Vegas, that is a sigh of relief for the fans and probably for him in his camp. He told me he'll be fine in 2 weeks, but they always say stuff like that. So we'll find out how it actually goes. Thanks for the time, Dr. Joe, and appreciate the updates. Go Team USA.
Thank you. We'll be cheering them on, that's for sure.